Hi, I'm Dr. Scott Haggerty with Elite Health and Wellness. Today, I'd like to introduce you to Matt Stevens, Doctor of Physical Therapy with Elite Rehabilitation and Performance. Dr. Stevens, I'd like you to tell us a little bit about yourself, about where you went to physical therapy school, and a little bit about your educational background.
I completed my undergraduate work at Baldwin University in pre-physical therapy and exercise science. Then I completed my doctoral work at Walsh University. Since then, I've continued my education and have become certified in dry needling, which is a Western approach to acupuncture, and also Thai massage.
Now, Matt, what are some of the conditions that dry needling is beneficial for?
Dry needling is great for any acute tissue injury, muscle strains, sprains, headaches, also symptoms as far as low back pain, chronic neck pain, sciatic pain, to relieve trigger points in any kind of conditions, whether they're postural dysfunctions or recurrent repetitive injuries. Dry needling seems to work pretty well for all those conditions as far as toning down the pain and as well as returning function to that muscle tissue.
You know, from experience with a lot of the patients that we manage together, it's been an amazing addition to our practice. We've had patients with long-term acute and chronic injuries that have really benefited from having dry needling. So it's something that could benefit just about anyone. Now, Matt, I'd like you to tell our patients and the viewers a little bit more about your approach to care. What makes you different from a lot of other physical therapists?
My approach to care is looking at the system as a whole. So not only do we want to address the actual acute injury or the pain, but we want to address the cause of that injury. Whether they're repetitive injuries, whether they're sports-related injuries, what mechanisms are actually causing the breakdown in the tissue or causing that injury. So we look at the system as a whole, from starting with the foot all the way working up to the head.
So, Matt, what are some of the ways that you work with different athletes? How would you take an athlete that comes in with an injury, and how would you evaluate them? What are some of the things that you would use to diagnose and then assess not just the current problem, but the actual cause of the problem, if that's not directly related to the injury?
Generally, we start with a functional movement screen for a lot of our athletes or higher functioning patients. That kind of takes the whole system approach to look if there's any deficits on a global scale, imbalances from right to left, top to bottom, front to back. And then from there we can dissect what's causing those exact problems or those injuries to the athlete or the patient.
Wonderful. So if you have any physical therapy needs, whether it's an acute or chronic injury, post-surgical rehab, if you're a high-level athlete, or someone who's just been dealing with a long-term issue that you want to get an evaluation, please make sure you come in and see Matt Stevens, Doctor of Physical Therapy, with Elite Physical Therapy and Rehabilitation as soon as possible. Have a great day.